So good morning and thank you for joining us. My name is Mike Icardi, the membership specialist here at the Dental Society. Welcome to our seminar, Long-Term Care Insurance, Is It Worth It? I have the pleasure of introducing our speaker. Michael D. Wong, CLTC, DDS, is a San Francisco native who went to UC Berkeley and graduated from UOP Dental in 1994. A bad car accident ended his dental career in dentistry, but he's remade himself into an insurance professional who specializes in long-term care planning. Because Mike took care of both of his parents and his two children at the same time, he understands the trials of our sandwich generation and how emotionally and financially it stretches us to care for two generations. He lives in Belmont with his wife, two children, and their Labradoodle. Mike loves to watch his two children play baseball and soccer and often helps with fundraising for his children's teams. Mike has been a SMCDS business member since 2019. So please welcome Michael Wong.
Thank you for coming this morning. And today we're here to talk about long-term care and specifically long-term care insurance. Is it going to be worth it for you? So a little bit about myself. I went to UOP for dental school, graduate in 94. I have a certification in long-term care, and I'm with a group called LTCR, which is Long-Term Care Resources. So we are a national group, and we help do group long-term care benefits. So we have over 650 affiliations with the schools in the US. So basically all the University of California's, all the Cal States. So Berkeley, UCLA, Santa Barbara, some of the private schools, Stanford, NYU. And then we have affiliations with some of the dental communities, such as the American Academy of Orthodontics and the AGD as well. So today's agenda, so what is long-term care? Who pays for it? Long-term care insurance options, tax deductions, and the mandatory long-term care in Washington, and some common beliefs. So no one ever thinks they're going to need long-term care help, but if you did, how would that affect your family? How would that affect your spouse or partner? How would that affect your finances? So I just want to tell you a little bit about how it affected myself and my family. So these are my parents, May and Frank. So this was my wedding in 2001. So my mom, May, 2 months after this picture, she developed stage 3 lung cancer. So my wife and I took care of her for about a year, but after a year, she needed 24-hour-a-day care. So we had to hire someone. And at that time, we didn't know where to go. We were just flying by the seat of our pants. And we had to think about, well, how much can we afford to pay this caregiver? So at the time, it became really difficult for my wife and I to get answers because there was just like no one to help us. So after my mom passed away, we said, okay, we can't do this with my dad. So with my dad, we were able to get him a long-term care insurance plan. And luckily we did, because probably about 3 years later, he started to develop some dementia. And he was living on his own in San Mateo Village, but he started to exhibit some, different behavior that the neighbors would tell me. So I found a place for him to live, actually Atria in Foster City or San Mateo. And so he was there for a couple of years, but what happened after that was his dementia really escalated after he was diagnosed with Parkinson's disease. And so when his Parkinson's disease was told to us, his dementia just escalated to a lot higher level. So the more dementia he had, the more help he needed. So initially we were okay with his bill, about $4,000 a month at Atria. Then it went to $8,000, and then it went to $10,000, $11,000. So that's when when you hear those prices, you think, oh, those are crazy prices, and they are. But the long-term care insurance kicked in. It didn't take care of everything, but it took care of about 3/4 of it. So that took a lot of the pressure off of my wife and I to figure out where he could go, because when money is a constraint, then your choices are a lot less. So he ended up, his last days were at Sunrise in Belmont, which was close to us. So what is long-term care? So long-term care is needing non-medical help for daily activities we generally do on our own. So when you wake up in the morning, you might take a shower, get dressed, eat some breakfast. Those are things that people need help with. So, really long-term care, the true definition of long-term care is the inability to do 2 of 6 activities of daily living without assistance. So it doesn't matter that how you got there. It could be from a physical disability, or it could be a cognitive impairment. Doesn't matter how you get there. It's just that you're not able to do 2 of the 6 on your own. So next there's 3 levels of long-term care. So first is home health care. So with home health care, basically someone comes to your house, they'll help you with activities of daily living. They might help you do some housekeeping, light housekeeping, maybe errands, take you to doctor's appointments. And in the US, 75% of the long-term care is in home. So many people prefer to be at home. It's just more comfortable, makes things a lot easier. But sometimes for people that have more needs, they need 24-hour-a-day care. So they might go to a residential assisted living facility. And at these places, there's always aides 24 hours a day. It's all inclusive. So your meals and your room, you basically have almost like a small dorm room if you've never been to one of the Atras or Sunrises. You have your own bathroom, and there's always someone there. So about 10% of the people that need long-term care opt for this. So next, we'll go to skilled nursing. So this is like the proverbial all these years, oh, I don't want to go to a nursing home. I mean, this is kind of, what everyone thinks of long-term care. So here, the difference that differentiates this from a residential assisted living is really the medical care. So at these facilities, they can, do catheters, they can do, in some cases, dialysis. So they could do more of the medical things that assisted living facility can do. And they have medical staff on 24 hours a day. The assisted living facilities, they have a nurse on staff, not necessarily a physician, and they're there for the business hours. They're not there 24 hours a day. And so about 15% of the people reside in a skilled nursing facility. Okay, so how much do things cost? So so these are current 2023 prices. So a good rule of thumb is that prices for home care, assisted living, nursing home increases 5% a year, okay? So right now, if you look at home care here, so home care is about $92,000 per person for 1 year, okay? So this is 5 days a week for 20 days. So this is not full-time care. It's more like 1/3 time care, okay? And then the assisted living is $82,000, a little bit cheaper, and nursing home is about $150,000. The nursing home is a semi-private room. So basically you have a roommate in there. Okay, so in 10 years, you could see it'll go up 50%. In 20 years, it's going to double. And in 30 years, you're looking about 3 times the amount of today's prices. Any questions so far? Yes.
So what's the difference, the assisted living and the nursing home? The price is like double,
Mm-hmm.
right?
Could,
So the services, what is the difference in services that they provide that makes the other one so expensive?
oh, it's because of the medical care.
I see.
The medical care really boosts up the price a lot because the staffing and the medical care is what.
They provide everything, all inclusive plus the medical care.
Mm-hmm. Mm-hmm. Any more questions on that? Yes.
Just one comment, because I have a lot of experience in this. Too.
Yeah.
You end up in a lower level when it's just, and you develop significant medical problems, sometimes they kick you out. So
Yeah.
you need to at least have it provided for, or be impressed to go into the higher.
Yeah. So what's the price to go to a higher one? Or
No, I'm just saying that if you are in assisted or you're in the lower levels besides skilled nursing, many of the things, I mean, where your mother is, you end up going to the next one, and they won't take care of you anymore. So you're out of the looking process.
Yeah. So with my dad, actually, you know, you have a good point. So my dad, he was with the general population at Atria. And so those are, you know, people that need assistance, but in general, they just need some help. But when his dementia went up, he was put into they call it the memory ward. So Alzheimer's and, you know, advanced dementia patients. And so basically it's a higher level of assistance to residents. So lower amount of people. It's basically a lockdown facility. You know, they're not going to wander out. But if you the price basically doubled. So he went from about 4,500 to about 9,000. So because of the level of care, the price jumped dramatically. And as someone needs more help, then they start adding points. So, you know, I would always get the call, oh, Mike, we need to add more points. Well, how much is that going to cost? So eventually when my dad finished, you know, when he passed away at Sunrise, he was about 11,500 a month. So he started in a private room by himself, but I kept on having to downsize him because the price just kept on going higher and higher. So, you know, it was 11,500 and his roommate was so close to him, he basically could almost hold out his hand and touch him. So he went from a fully private to something where he had a roommate. So that's how much the prices are in especially in the Bay Area. We're probably one of the highest in the nation.
Insurances will cover all that expenses?
So it depends. So it covers the expenses, but I'll go into how much it would cost in a little bit.
So just a percentage, they don't cover 100%.
It depends on what type of policy yes. Yes, exactly. Yes.
So if you have the long care insurance, but how about Medicaid? Would Medicaid help for Medicare? Whatever, I don't know. Medicare is different than Medicaid.
I'll talk about that in a minute, but good questions. Yes.
Atria and Sunrise also have nursing? They went from assisted living?
No, they don't have nursing. Yeah. So assisted living, they have two parts. They have the general population and then you have the memory. Most have two parts there. But the skilled nursing would have to be somewhere else. I mean, you know, we always think of Laguna Honda. That's the proverbial, you know, skilled nursing facility. Okay. And then I'll get to your question about Medicaid and Medicare. Yes. Yeah. So how much care do you actually need? So in general, so these are statistics. So men live to about 83 and women about 88. That's kind of just the average. So for men, you know, they need about 4 years of care, women about 5 years of care. So if you ever go to any of the facilities, you see that there's proportionally more women than men at the facilities. If you have dementia, you're going to need about 6 years, Alzheimer's 8 years, and then Parkinson's disease, which my dad had, about 11 years of care. So what are the options for long-term care? So in the private care is basically you can have your family take care of you. You could use your own money, or you could have some type of insurance. With the public option, which we're going to talk about, so basically there is Medi-Cal, and then coming up is, so there is a proposed California state long-term care program right now, and I'll go into that. So that's coming in about 2025, and I'll share with you some details about that. But let's look at the public option first. So basically, you know, there's there's Medicare, which is health insurance that you get when you turn 65, and then there's Medi-Cal. So Medi-Cal is more for the impoverished, for the low income people. So to actually get any aid for assisted living, you have to be on Medi-Cal. And health insurance does not take care of this either. So you have to be on Medi-Cal, not Medicare. So Medi-Cal, what they do is basically they are like, if you think of all the nursing facilities in California, Medi-Cal pays for about 65% of all the people in a nursing home or a nursing facility right now. So that's a large proportion, and you saw how much it costs. So that's a large proportion of the California budget going toward nursing home costs. So they do offer some in-home care for Medi-Cal, limited, and the reimbursement is low. So there's no assisted living. So you remember there is the home care, assisted living, and then the nursing home. So the middle one, they don't offer that to Medi-Cal recipients, just the nursing home and limited home care. And it's based on income. Basically, you need to make under about $2,500 a month. So it's based on income.
I think it's lower than that because I went to that with my mom. They said if you have higher than 1,300, you don't qualify.
For a single person.
For one single person, yes. Even if you're on Social Security, like my mom was, that she would not qualify because she was getting more Social Security and a pension that qualifies.
Yeah.
This bar is very, very, very low.
Yeah.
That does not work for most of the people.
Yeah. So they look at your income, and then they look at your assets too.
Savings, you have a car, all that. But they say no, you don't qualify.
Yeah. So it's very,
Yes, which we work, we pay for the taxes, we don't get anything.
Yeah, I know. That's what I say. The middle class is the most.
So here is. Yes, that's kind of how it is. So, okay, let me talk to you quickly about this. So this is right now, you think about, government long-term care program. So, and I'll go into this later on the slides, but basically California is working on a mandatory long-term care insurance program for everyone in California. So what that means is it's going to be similar to the Washington Cares program. So right now they're taxing in Washington, they're taxing everyone mandatory tax on their salary, and they're giving everyone a long-term care insurance. But right now in Washington State, you saw how the prices are. They're giving them a maximum of $36,000. So $36,000, you could see from the prices, doesn't go that far. So California is working on the same thing they've been working on for past 18 months. I look at all the meetings, so they plan to implement it in 2025. So that means that means additional tax on everyone's income, which will be coming. No, you're going to be taxed. Yes, not free. Unfortunately, not free. Yeah, tax. So no, it is a premium. You're getting taxed on your wages. So for every $100 right now in Washington State, it's 0.58% for every $100. So ballpark is every 100,000 you make is $600. Okay. Yeah, exactly. But I'll go into this in a little bit more. But I understand what they're trying to do. They're trying to help everyone, but for the people that earn more, it's probably not the best program for them. And I'll talk about how to potentially get out of this tax, because there was a small window for people to get out of this tax. If you miss that window, you're stuck. Even if you got your own long-term care policy after the date, you're still stuck. So California is probably going to implement some of the same things that Washington. Washington was the guinea pig. California is going to be a close second or third? Okay, so I want to talk about, so your money versus their money. When I talk about your money, you know, the money you work, you know, working every day. Their money is, you know, insurance is money, okay? So just say you needed care and it costs $1, okay? So you saved a lot of money, right? You're working hard, you saved a lot of money. So I get this all the time. Well, I have a lot of money in my IRA. That's great. But remember, there's one thing you didn't pay. You didn't pay your taxes yet. So if you needed $1 for a long-term care expense, you need to take out $1.40, okay? So basically reverse leverage. So other people say, well, I have a lot of stocks. You know, I have a lot of Tesla stock. I'll just start liquidating that. Okay, well, you have capital gains tax. So it'll take $1.20 to, again, gain that dollar. And some people say, well, I'll just use cash. You know, cash is great, but you got to remember, so the numbers that we saw, so it's dollar for dollar coming out of your income or your savings. But when we look at long-term care insurance, basically it comes out that you get about 120 times the leverage. So for this $1, it would take 0.008 cents to give you that $1. So here it's just, you just have a tremendous amount of leverage. And that's what insurance is. Insurance is leverage, you know, for your home, for your car, for your health. It's just leverage. And so that's what it is here. So here is, how's a long-term care insurance policy work? Okay, so when you buy a long-term care policy, when someone buys it, there's different, you know, you could buy a smaller one, or you could buy a big one. So it could go from 100,000 to unlimited, you know, whether it costs 1 million, 2 million, 3 million, you know, I'm still covered. So in this example, we'll use 200,000. So you have a bucket of money. So it's 200,000 here. So the next part is, well, what's the maximum monthly benefit? So here, and when you examine any type of long-term care policy, they're going to say what your limit is. So in this example, 200,000. Then you're going to ask, then it's going to say, what's your maximum monthly benefit? So these two are really the most important things here, because your maximum monthly benefit is $5,000 a month. Well, how long will that $5,000 a month last? It's going to last 40 months. On policies, it'll have a number of the months, but the months doesn't really matter, because just say, I don't need 5,000, I need 4,000, it's going to last more than 40 months there. So you have a bucket, each month 5,000 comes out, it'll last 40 months. Okay, and what options do you have? So there is going to be two main options. The first option is going to be an inflation protection. Remember, I told you that long-term care prices go up, you know, 3 to 5% a year. So the inflation option is meant to keep up with the inflation. So what happens with that? So basically, if you did 5% inflation, every year on your anniversary, this goes up 5%. Okay, so this continues to grow to keep up with inflation. And then let's look at the elimination period. The elimination period is unreimbursed days. So typically it's 90 days. So which means that you pay for the first 90 days out of pocket. On day 91, your benefits kick in. Any questions on that? Okay, let's move on. So triggers and types of long-term care insurance. So remember, we talked about the two of the six daily living activities or cognitive disability. So remember, it's not how you get there, it's just that you need help. So if you need help with 2 of 6, do the physical, or you have a cognitive impairment, you would qualify for long-term care benefits. You know, whether it's through the state, through Medi-Cal, or whether it's private insurance, that's the definition. So what does it pay for? So it pays for home care. If you want to be at home, it can pay for home care, assisted living facilities, and the nursing home. But one of the other things about long-term care insurance is they give you a care coordinator. Remember how I said with my mom, we were flying by the seat of the pants. We didn't know where to go. With the long-term care companies have people there, they're called care coordinators, that will help you find the facility, figure out what type of care you need or a loved one needs. So there's someone there that you can call to help walk you through the process. So you're just not alone. And then how do they pay? So they pay primarily on a reimbursement method, which means, so just say someone goes into like a senior care facility January 1, and the family will pay the rent and everything for January. You turn in the receipts, and then toward the end of January, you get reimbursed. So it's called the reimbursement method. Okay, so let's talk about there's basically two types of long-term care insurance. There's traditional and then there's hybrid. So when you think of traditional, it's very similar to, like, my wife's a realtor, so like home insurance. And basically what happens is with traditional, you kind of, with traditional, you have a cap on how much benefits you have. So 500,000, 1 million, there's typically a cap. And you pay as you go. So just like any other insurance, when you pay, then you have your coverage. And one of the other things is the rates can go up. So the rates are not fixed. And if you've been aware of like CalPERS or some of the other long-term care insurance companies, they've had to increase rates the past couple of years. So now let's look at the hybrid. Well, what's the hybrid? So hybrid is more like an asset. And so, it's basically life insurance and long-term care insurance together. Okay. So with that, the rates are fixed, just like a mortgage, the rates are fixed, and it's a finite amount of time you're paying for the policy. So 5 years, 10 years, 20 years, you can pay it off. And the other thing is that, just like owning a home, if you want to use it, you could use it, right? If you want to sell it, you could sell it, which is basically the return of premium. And if you never use the benefits, it becomes life insurance and you can pass it on. And the other thing that's unique about that is the benefits are uncapped. So meaning that typically the traditional is about 500,000 limit. The hybrids are, if it takes 1 million, 2 million, 3 million, doesn't matter, the benefits are uncapped. So I'll go into more detail in the next slide. All right. So let me give you an example of traditional long-term care. So Tammy purchased her policy when she was 55, okay? So you remember the bucket. So her bucket at that time was $216,000. What did I give her? That gave her $6,000 a month for 36 months, okay? So she purchased the option. Remember, there's two options. The annual benefit increased 3% on her anniversary, and then she had the 90-day elimination period. Okay, let's fast forward 20 years. So now, because of the inflation, her benefits went from 216 to 390. So now she gets $10,830 a month. Does she have to use all of that at one time? She doesn't. She can use anything below that. She can use that. So 8,000, 9,000, and it will just extend this. So this is 36 months at 10,830. And so even while you're receiving benefits, this amount still increases. So the inflation is still working for her even while she's using benefits. And remember with the elimination period, so the first 90 days, she's having to pay out of pocket. Day 91, she'll have her benefits will kick in. And many of the policies have it that when you're on claim, the premiums are waived. So in my instance, with my dad, when his premium was high because he had diabetes, high cholesterol, high blood pressure. So yeah, a lot of things going. And he was probably about 74 when he bought his policy. But when his benefits kicked in, we didn't have to pay a dime more in premiums. Yeah.
What happens after those 36 months? You don't get coverage?
Then after
Just 3 years.
Mhm.
You live much more than 3 years and they need more.
Yeah, in that case, if she used up all the bucket, then that's it. So it depends on what type of policy, and basically it depends on the size of the bucket. The larger bucket will last longer. The unlimited, of course, then your bucket never runs out of money. My dad had traditional, and so what happened in 2010 was that before, all of the traditional long-term care policies were unlimited before 2010. So my dad had Genworth, and so he was easily over $500,000. And it was unlimited. If he went to $1 million, $2 million, it wouldn't matter. 2010, many of the companies put the $500,000 limit. Okay.
For how many months?
So it depends of how expensive your care, but they start to cap how much you could actually purchase. So, with many carriers, it's very rare to have unlimited now. Before it was commonplace. Now it's rare for the traditional. For the hybrids, you can still have unlimited. Did I answer your question?
After 3 years, you stay. If you waste all the money in those 3 years, you're gonna have to wait to get that other money to last more. You have to sign up again to continue the premium.
Well, so once you use it, then that's it. So that's why planning is really important. It's
with life, you never know how many years you're gonna live. So
exactly, yeah.
Plan, like you say, I'm gonna plan for 3 years or for 10 years. Maybe I live 20 years more.
Exactly.
See,
Yeah,
so
I agree.
Yeah.
And that's what makes this. The general statistics are this is going to affect 7 out of 10 people. So, but only 10%. So you are part of the 10% to actually plan for this. I mean, it's amazing that affects so many people, but yet only 1 out of 10 actually plans for this. So I applaud you for coming in and finding out more. But yes, you are correct that this is more like health insurance than like home insurance, right? Home insurance, car insurance, you kind of have an idea. Right? With this, it's like with health insurance, if you get cancer, you don't know how long, right? You have no idea how much the medications are going to cost. You don't know how long you're going to be cancer. It's exactly the same thing. You just don't know. You just have to do your best to plan and, do your best to plan for it because you just don't know. Like with my dad needed care he was in the facility for like 8 years. Right? Long time. Yes. Uh-huh.
So for the hybrid, let's say that you bought the policy for unlimited, but if the person passed away before and the bucket still has the money, would that money can be transferred to someone else or how would that work?
Good question. I'm going to get to it. Okay. This is a great question. So the hybrid policy. So with the hybrid policies, we talk, you can live, quit, or pass away. So that's what we talk about, these hybrid policies. So let's talk about if you need long-term care policy. So remember I said it's life insurance and long-term care. So you basically have 2 buckets. So here's the life insurance bucket, and here is the long-term care bucket. So what happens with these types of policies is you start drawing. So it covers 2 people. One policy covers 2 people, okay? And when one needs long-term care, you start drawing from this bucket. So just say what happens is that you deplete all this money in this bucket. What happens here? Then you go to what's called continuation benefits, which is basically on the insurance company's dime. So here it's unlimited lifetime. So whether if you have Parkinson's disease and you know, it's 11 years, they'll still continue to pay for it up until you don't need the care or you pass away. Okay. So then the second scenario is, well, so you know, we pay a lot of this money, but well, what happens to our money, right? And so then that's when it becomes life insurance. So second to pass. So as a couple, when the second one passes, the life insurance goes to the family or to the kids. So all the money you put in there will come back. It won't come back to you necessarily because, you know, if you're gone, but it'll go to the kids. Yes.
Okay, so most of us here probably have life insurance already.
Mm-hmm.
So if we buy this benefit, that would be another set of life insurance plus the assisted living
Mm-hmm.
coverage. So the life insurance, for example, you know, most of us would have like the term insurance,
Mm-hmm.
life insurance for 65, right?
Mm-hmm.
So after 65, that's gone. So now we have to buy this insurance that has the life plus the continuing benefits.
So it's so basically, when you think of the traditional is you pay as you go. If you never use it, and it's, you ever hear the term use it or lose it. That's basically traditional, use it or lose it. So this takes that off the table because if you never use it, then you can get your money back. So it doesn't, it's not in lieu of like a term life insurance policy, but it's almost like a bonus. It's almost like a bonus because one of the complaints about long-term care insurance is, oh, the premiums, you know, oh, I don't think I'll ever need it. I pay and I never get anything back. So that takes the equation, that takes that question out because the money will go back to you somehow. Okay, not, okay.
If we buy the hybrid long-term care, should we cancel the life insurance?
That's everyone has a different situation. We'll probably have to look at. Yeah. It depends. It really depends on your situation with the kids. Do you have kids? Yeah, it depends. Like with this, it's almost, I would say that if it were, I would probably keep both. And the reason is that with your term insurance, you probably have a higher amount of life insurance. This life insurance will be closer to what you put into it. So whether you put in 100,000, you know, over the lifetime or 200,000, your life insurance would be closer to that. But if you need $1 million for your kids' education or whatever, you need to keep your term insurance intact because this is solving long-term care really. And this is, you know, taking the uncertainty off the table, but it's not in lieu of what regular term insurance does, where it really, you know, gives you a high amount of leverage to pay for your mortgage and kids' college and other things like that. Yes.
What you put in it, is this invested at a certain amount?
Yes. So basically, if you think of like a whole life policy is you know, like a lifetime policy. They give you interest. So right now they're giving you about 3.5. So if you ever need to borrow the money or take the money out, you can. Okay. Any other questions there? Let me get, so let's go to the third one. So just say, you say, oh, you know, Mike, I've had this for a while. I just want my money back. You can get your money back and you get a percentage on there. So you could either use the benefits. You can, if you don't ever use the benefits, it goes back to the family. If you quit where you don't want the coverage anymore, then you can get your money back. Okay, so let's see how it works. So this couple here, so they bought a hybrid long-term care policy. So remember, the life insurance gets used first. So it's $200,000 life insurance and unlimited lifetime care protection. So Sam has a stroke. So remember, we're depleting the life insurance first. So $6,000 a month. So he draws on the life insurance. Okay. So now, after 33 months, he depletes the life insurance. That's gone. So what happens? So we go to the continuation of benefits, which is the unlimited. So they continue to pay for him. So, but what happens to his wife? So his wife, 4 years down the road, needs care. So for her, she actually gets $6,000 a month for the rest of her life. So it continues for both of them until they don't need care anymore or until they pass away. Any questions on the slide? Okay. So with the hybrid, they actually have unique ways to pay for it. So if you're younger than 59.5, so A is you can pay as you go, similar to traditional, or you could treat it almost like you're paying a mortgage. So you could do yearlies and then pay off in 20 years, or you could do a down payment and pay smaller premiums, monthly premiums. But the other thing is that with life insurance and this type of policy, if you have an older, like whole life policy, you can actually do what's called a 1035. So a 1035 is a exchange where you can use an old life policy or annuity, and you can just move the money. So it doesn't mean that you're cashing out, you're just moving it in between. So just like a 1031 real estate exchange, you kind of have to exchange your property for something that's like or a little bit lower. So same thing here, where you could exchange old life insurance policy. So maybe if you had an old one that you weren't going to use, you could exchange into this type of policy. So if you're over the age of 59, you can actually use retirement funds. So you can use taxable retirement funds, IRA, SEP-IRA, or 401k for these types of policies. So that helps some people because they might not have a lot of liquid, but they'll have money in retirement. So did you know long-term care premiums are tax deductible? So C Corps benefit the best because they could take the deduction in the single tax share as a business expense. Of course, talk to your tax accountant. With S Corps, partnerships, and individuals, you're able to deduct the premiums based on the age tier. And third is you can actually use your HSA accounts to help pay for the long-term care premiums. So here the deductions are per person. So when you're 40, it's about 500, over 40, about 900. So as you start hitting 50, 60, and 70, you can see the deductions are higher. And same with the HSA. So these deductions are typically adjusted yearly. From 2020 to 2023, they kept the same amount of deductions. So let's talk about what's coming up. So in Washington State, they implemented a mandatory long-term care insurance program. So this came out in 2021, and it was basically a mess. And what happened was they said, okay, we are going to tax everyone that is an employee 0.58% for every $100 they make. But what we're going to do is we are going to give you till November 1st, 2021 to get a long-term care policy to opt out of this tax, because this tax is going to come January 2022. So what happens? Everyone's rushing to the door to try to get out of this tax. So it would, and Washington didn't plan right because, well, what big a policy should you do? How much do you need to do? Can I buy it and then terminate it like 2 months later just to get out of this tax? So Washington didn't get their act together. And so it was, they still don't have like minimum requirements for it right now. So, but how it worked was that you paid into the program. It's a 10-year vesting period. So you have to pay into us for 10 years, okay? And the max benefit is 36,500. So we've seen that that's kind of low. And remember that we have the 2 out of 6 activities of daily living. They require 3. So you have to do 3. You have to not be able to do 3. So the requirement to get your benefits is tougher. So it's 3 out of 6. They shorten the elimination period and basically home or facility base. And so, but the other thing here is no contribution cap. So what it means is that the person that's making $50,000 a year is going to get the same benefit as someone making $500,000 a year, but who's going to pay more tax? The person that's making $500,000 a year, but they're getting the same benefit, right? So, and what happened was that, remember, everyone's rushing to the doors, November 2021. So a lot of people got caught out and they didn't get into it. So the California Insurance they've told us not to talk too much about it, but I actually like to talk to people about it because it's coming. So they expect it to be implemented January 2025. And they've been having meetings for a year and a half already. And one of the things, so I've been on the calls. One person made a comment that sticks in my mind. They said, we have to make sure the high income people are supplementing the low income people. So I was like, whoa, really? And so basically, this of the no contribution cap, I totally see that coming in. That the high wage earners are going to supplement the lower wage earners. And they're talking about this amount. So this amount is really low. I mean, you could use this in 2-3 months, or less.
But how much are you gonna make the pay tax until we retire?
So you have to pay for 10 years. If you're close to retirement, so according to Washington, I can't tell you everything about California, but in Washington, you have to work at least 3 out of 6 years, and then you'll get partial. You won't get the full amount. To get the full amount, you have to pay for 10 years. Retire. If in California, well, I can't tell you about California, but in Washington, then yeah, then you just don't have it. If you're retired, you just don't have it. Yeah, because yeah. So. So to get out of that tax, the only way to get out of it was you had to have a private long-term care policy, or if you're like at Microsoft, my nephew's at Microsoft, or some type of group long-term care policy, you have to have that in place. And at the time, you had to have it in place by November 2021. They told everyone about the law in the summer of 2021. So to get through the process of long-term care, it takes 2 to 3 months for us to get clients through the process. So you can see how everyone's going to the door. It takes 2 to 3 months. There's going to be a lot of people that get stuck outside. It's just not enough time. And that happened. And with the insurance companies, because of the glut of people trying to go in and trying to get, oh, I'm only going to get 10,000 in coverage. Oh, I'm going to get 20,000 in coverage. The insurance company said, it takes us so much money to underwrite people. We're just pulling out. So what happened in October, Mutual Omaha, One America, all the main companies, they're like, we can't do this. We're pulling out. So there's probably only 1 or 2 carriers that stuck with it to that deadline. So California does not want the same thing. And what they're going to do is how like January 1st, sometimes you're looking at papers like, oh, this law just came on. Oh, I didn't realize that. California is trying to be stealth that way. They don't want everyone to know. I mean, insurance agents are talking about it, and some financial planners are talking about it. But in general, there's not going to be a lot out there because they don't want the same thing happening. But fortunately for you, I'm telling you about it so you can prepare, because it's going to affect not only yourself, but your staff. Because it's going to be up to you to have to do the deductions for your staff.
So the 36,000 roughly, if you pay for 10 years, would it give you the benefit benefit until you die, or there's also a cap on that?
Oh, until you die. Yeah. So let's look at, so Washington Cares. So this is a comparison. So a 40-year-old in good health condition. So this is the income level. This is how much they pay, they're going to pay in tax. Okay. So just say, we'll just say like 200,000. So someone makes 200,000. This is how much they're going to pay in tax per year. Okay. So this is what they would get in the Washington benefits. If they just bought a traditional long-term care policy that grows at 3%, remember growing at 3%, it has that inflation protection. This is going to grow. They get almost, almost 4 times as much coverage for the exact same amount of price as doing the state one.
And at what age do they require someone to buy the long-term care for let's say Washington? What if they start?
18.
18?
So if you're 18 and you work at Jamba or something, you're gonna get taxed. Work at Starbucks, you're gonna get taxed. Yes.
But they don't need their long-term care until many years.
Yeah, really. Yes. Yes.
So do they have something where you turn 65, you don't have to pay into that, or you're still continuously?
As long as you're, as long as you're working. Yes. Yeah. But you remember, so this is kind of it, right? It's almost like the box top is on, so there's no increasing it.
But if you're not working, but there's an income still coming in.
Yeah, so it's taxed on income. Yes, income. Yeah.
And the people that are not working, how long they get to sign up for that?
Oh, so it's. I mean, there's some exemptions for some spouses like military or government workers. So the California hasn't worked all that out. I know that. So I'm talking to you about Washington. Washington, the tax. So they tabled the tax until July. So July 22nd is the hard start date that they're going to start taxing everyone. So they pushed it out because they knew that there was a lot of confusion with a lot of people, a lot of the pushback. But July 1st is there's no going back. That's when they're going to start taxing everyone. So California, like I said, it's going to be more a stealth rollout. So what they're going to say is you have to have a policy in place by January 2025, which means in 2024, your policy has to be in place. Doesn't mean that, oh, I submitted the paperwork and it's going through. No, it's going to be hard stop there. So everything needs to be in place before 2025. So they talk about it's going to be January 2025 or when the governor signs it. So which could be potentially earlier, but we just don't know at this point yet. So it just means, just be aware of that, plan early. As we get closer to that date, then more people find out. Like I said, it's going to be a rush to the fire exit, right? So it's going to be crazy. We're expecting it to be pretty crazy, in the fall of 2024.
Did they say what California max is going to be?
For the benefit, they're kind of all over the board. If you go to the meetings, there's a lot of people in the meetings. There's some people that are, basically this, if you think of this is $100 a day. That's what they're saying. So some people are like, oh, $100 a day is pretty good. Some people are saying, oh, that is so little. Let's do 150,000. But knowing California, it's probably going to be closer to this because they want to fit everyone under there. So any more questions about that? Okay, so these are common statements. So I've been doing this for 8 years, so I get common statements. So one is, I'm healthy, my parents lived a long time, but really longevity is the biggest risk factor for needing long-term care. So it's great someone's healthy, But what happens is about a quarter of the people over 85 actually required care. So I have enough assets to self-insure. I probably get this like 100% of the time. so it's unlike car insurance. You know, you kind of know how much it costs to replace your car, right? You know, 65,000, 100,000, you kind of know. But long-term care is akin to health insurance, right? Where you just don't know, and you don't know the duration, the extent, and how much the costs are. It's unknown. And the other thing is, so premiums are too expensive. And, you know, that's probably, you know, those two I get the most. So if you think of, here's a 50-year-old couple, and so they're considering, you know, to self-fund, or should they think about getting a long-term care policy? So this is just an example. So if they wanted to self-fund, so, and in general, remember I said 250,000, it sounds a lot, but really with the long-term care, you see that 250,000 can go fast, especially if two people need it. So here, if they decide to put away 500,000, okay, we'll put away 500,000 for long-term care costs. So as time goes, that they get 3% interest, you'll see in 20 years, they'll have, you know, about 900,000. Well, what happens if they use leverage and they use long-term care insurance? So two people for the same amount of coverage beginning today, 500,000 will cost them about 30, almost about 4,000 a year. So about $300-something a month. And they'll have the same amount of coverage, just more leverage, you know, down the road. So here you could see that the numbers are pretty similar there. So I just wanted to show you that it's like, what's the better way to do it? You know, put it 500,000 away today, or spend, you know, 39.81 to get the exact same thing. I mean, what can you do with your, you know, what can you do with 500,000, you know, toward investments, to buying property, or, you know, doing something else to make your money work for you, instead of just, you know, saving it, putting away just in case. So a couple final takeaways. So long-term care insurance, it's customizable. You know, people say, oh, well, how much is the premium? Well, it depends. And it depends how much you want to cover. Remember, I said the bucket determines how much your premium is going to be. If you want a $100,000 bucket, it's going to be cheaper than a $500,000 bucket. It's up to you. It's up to you what you want. You want, oh, I want to cover 50%, or I want, you know, full coverage. I want to cover everything. So everything's customizable. And so these are some really important points. So ways to save money on the long-term care policy. So some people think, oh, I'll apply myself. Oh, my partner doesn't believe in long-term care insurance, but I believe in it. So I'll just do it alone. What actually happens is you get a really substantial discount by applying with a partner. So you really don't save much money by going at it by yourself. And so the inflation protection. So when you talk to a professional, they're gonna work, like I play with the inflation protection, because some people, it's good. Some people, it raises the premium too much, because that's probably one of the most expensive options. So it depends on your age. If you're more advanced age, you might not want to add it because it's going to add a lot to the premium. You might want to take it off, but start with the higher monthly benefit. Remember the monthly benefit at 5,000? Well, maybe I want to start at 9,000 and have no inflation protection, and I could get a higher amount with maybe less costs. So that's one of the other options. And then with us, with LTCR, you know, because we deal with other associations and the alumni groups, we actually can get people 5% discount on traditional. So, you know, if you talk to, you know, financial planner or anyone, they can't give you the 5% discount. We're the only ones that can do it with traditional, not with the hybrid. And then here, again, talked about the California's program. It's going to come without warning. And remember, it takes 2 to 3 months to get through the system with the application. So plan appropriately.
So for the long-term care, do
The most important thing, so no matter what the age, the health is the most important, because the insurance companies are looking at, the risks, they're assessing the risk, right? They want healthy people. If you have dementia, they have these questions on the forms. They call them knockout questions. If you use you use a walker, or you had like memory issues, then basically you get knocked out. I mean, so they'll have these questions on there, but it really depends on the health. So, and the earlier you buy it in life, and the healthier you are.
You can't get initial signs of something, and then
If your dog, so so you all know how it is. Once it's in the chart, right, it's hard to unring that bell. So same thing with the medical records, because we basically do, there's going to be a phone call, then we get medical records, we get prescriptions. So they're going to do their due diligence to make sure that you're healthy enough for them to offer you insurance.
And there's so many insurance companies offer this. How do we know which one will be the good one?
Oh, okay. So AM Best and Moody's, those are the rating companies for insurance companies. So AM Best or Moody's. And so when you look at the companies, typically in the companies, they'll have, they'll put financials, and they'll put their ratings, typically A+. And so our company, LTCR, we actually have about 5-6 companies that they deal with, and they're all like A-rated. We only deal with A-rated. And the reason we have 5 or 6 is because everyone's situation is different. So there will be some companies that, well, if they have, especially like diabetes, oh, they have diabetes. One company will say, no, forget it, I can't do it. Another company is like, oh, well, maybe, try it. We submit, and let's see how it goes. And so many times when we talk to clients, we'll actually anonymously send email to the underwriter. We'll say, oh, this client has this, what do you think? They'll say, okay, yeah, good. Other ones like, borderline, maybe not. So, we do the preliminary work before we even start doing like application. But if you don't have the ability to have many carriers, and you only have like one carrier, like a one-trick pony, if they say no, then you're like, okay, well, I guess I can't get it. And we hear that all the time, that, well, and I'm not bashing financial planners, but financial planners, they typically have like Lincoln, MoneyGuard. Yeah, they don't have a lot of the other ones. So, that's all they have. So if it's no, then clients think, oh, I'm stuck, I won't qualify. But for us, we're able to try different carriers and see which one will work, and then we'll work with our clients to see, okay, well, now we can go with just say National Guardian Life, which is a good company. We can go with them, and we'll figure out like a plan. So, okay, so those are my questions. So any more questions? Yes.
Actually, 2 or 3.
Yeah.
This is a 2 or 3 month process, okay?
Mm-hmm.
Now, as a broker, you are applying to multiple insurance companies or a single?
What we do is we actually, after we meet, then we will send email. So I'll send email to mutual, and it depends on the health criteria. So if someone just say has, like I said, diabetes, I'll send one to National Guardian, I'll send one to Mutual, I'll send one to maybe the hybrid one in America. And,
after you did the process, where you selected one, or you help the client.
Oh.
Okay? So we're in a 2 to 3 month window.
Yeah.
And as we get closer to California getting it's going to narrow. So you got it because you need to use it. Now, your medical condition can change within 2 or 3 months, or however long it takes to run through. So those numbers are not going to stay the same. Okay. Now, from the standpoint of as a broker and from the standpoint of the insurance company, if they rediscover that you have it changed that you don't want to use, they can answer then, or how does that work? I mean, at what point in time does the carrier commit to the policy and the premium?
So the premium is always kind of a pretty good estimate. So once everything is set,
not what it is, it's going to be broker and
well, when they offer you when everything's written in stone is when they offer you, when you're accepted and they offer you the insurance. That's when it's written in stone. Up till then, everything can be adjusted. Whether they adjust it or you decide to adjust it, that's when it can be adjusted. But once there is a offer of acceptance, then that's when everything's written in stone at that point.
So during the 2 or 3 month period, if anything changes, they can change their mind.
Potentially, if you have a stroke during that time, yeah, definitely, because if you have a stroke during that time, then they're not going to accept you. I mean, that's
can go from 2 to 8. Okay.
Yeah.
I mean, there's a lot of things that go wrong with people.
Yes, I agree.
So this kind of one of those. It sounds to me like a look and see policy. I have a summer home. My brother's retired CCA for Cal Fire, and your house burns down in Queenheart. Okay, you ain't getting insurance anymore. Okay,
yeah.
So I'm stuck with my insurance I got 15 years ago. This thing's going to change the same way. Now, what happens if the companies start pulling out and the people who were there when this comes down? So is that going to happen?
For California, potentially. I mean, if we don't know exactly what's going to happen, and the problem with Washington was they didn't put the parameters in there. They kind of like threw this out there, but we don't have the parameters. How much do people have to buy? Do they have to hold the policy for 2 to 3 years? What they didn't do their due diligence with the insurance companies, and they didn't coordinate enough with them to figure out a plan and work together. So I would, Washington was kind of a debacle, I would say. So California doesn't want to make the same mistake. It doesn't mean that they won't make the same mistake, but it could potentially happen. I just go to the meetings and I just see how.
I don't want to be adversarial, but I'm looking at things that come up. My son-in-law had his house burned 2 years ago, and the insurance agent was right there, thinking they were being the assessment. He said, "Rob, you need to have a qualified advisor in this thing." This looks to me like if I was going to buy it, I should go down and retain an attorney to go with it too. So because there's going to be things that come up that are unanticipated, or insurance companies have that for offering you 50 cents when it really is worth $1.
Well, everyone has their opinion, and like, so my dad, I used the long-term care for my dad. So I totally think that do they come through? They absolutely come through. And I have other clients that they come through. Sometimes it's, I think sometimes the perception is, the big insurance companies, are they going to come through when I need it? So that's why you look at the ratings for the company. You look at financial stability. Like initially, there are, and one other thing is that I get this question a lot. Well, what happens if the insurance company goes out of business, right? FDIC, especially with Silicon Valley Bank. So California has what's called every state has it, California Life and Health Guarantee Association. So it's just kind of like the FDIC of insurance companies. So with long-term care, the limit is like 600,000. So does it mean that you're whole? No, it doesn't mean you're whole, but FDIC doesn't mean you're whole either if you have 400,000 in the bank and it only guarantees to 250. But it's something, so you're just not, you don't lose everything. So that's another question I get as well.
Well, yeah, it looks like you need somebody like yourself to guide you through the process and follow through it.
Yeah.
Otherwise, I can't see myself muddling through this and expecting to come up with the right answer.
it's complicated. I mean, guaranteed it's complicated. And, you know, this is something that is like so personalized. And, you know, it's like when you deal with the patients, right? So, you know the personalities, you know what, you know, if you have to do like an endo number 2 in the back, you know, someone can open wide, someone can't open wide. I mean, it's just like, it's so personal that you just have to, you know, talk to the right person. It's definitely not cookie cutter. Like you can buy life insurance, cookie cutter, you know, ethos or anything like that. But then this is so specific, and because it's open-ended, right? Like life insurance is close-end. Okay, 200,000, 500,000. This is totally open-ended. Okay, question?
Two questions.
Yeah.
So the first one, let's say that you pay the tax and you know, you have a potential to get a benefit from California program.
Mm-hmm.
But what if you move out of state before the 10 years, right? And so what happened to all that money that, you know, you've been taxed on? Would it go away?
That's what they're working on. So as of right now, Washington says no portability. Portability is to be able to use your insurance somewhere else. Like with all the policies we have, you know, if you move to New York or Florida, then you'll have coverage. On the long-term care policies, if you move out of the US, then they reduce the amount, and it might be for 1 year, but it really depends on each carrier on international benefits. But to answer your question, as of right now, Washington is not allowing portability. That might change. You know, I just looked at it this week. So that's in flux. With California, they're still working on it.
The second question is regarding to the assisted living. But now they also have their program for community, right? So could you explain that a little bit?
Community-based is just say, you know, in the Foster City, they have the senior center, right? And so just say they have, oh, we'll have a doctor here to do quick assessments of people. So, you know, we'll do blood pressure checks, we'll do, you know, podiatrists will do like diabetes check. So we'll have people. So that's more the community-based. So it's really, people don't live there, but you go there for some type of services.
And is there a group that would help you to say, you know, if you want to cook or assisted living, there's a lot of places that offer that. So if there's some resource that allow us to say, oh, someone would come with you and show you all these places and then you make the decision.
Oh, okay. So there's, so we offer like free of charge. So LTCR, so we basically have like a couple of different parts. So one is, of course, you know, the long-term care insurance, but we can always help you find the facility. But if you want someone to actually go and see the facility, then you need to hire someone. Actually, my sister-in-law, she does that for clients because she runs a care home in Pinole, and this is what she does. But there are people that just say, oh, I live in New York, and you know, my mom's in California. I'm not going to fly out there. So there are people that you can hire that will say, okay, well, what does he or she want? Where they want to live? Oh, they like San Francisco. Okay, they go to San Francisco once. Oh, they like, you know, they like this type of food. So there are people that you hire that will go and assess for you remotely, so you don't necessarily have to do the legwork. But I hear you, because with my dad, I did the legwork. I initially thought he was going to be in San Francisco. I grew up in San Francisco. And so I went to all the facilities, and then he said, oh, I don't want to live in San Francisco. So I'm like, what are you talking about? All your friends are here. He's like, no, I don't want to live. I want to live in San Mateo. So then I had to go there. But it does take a lot of work to do that. And if you ever, you know, have someone that needs to go look, I would say the best time to go is during a meal time. Yeah, don't ever go during in between like breakfast and lunch, or lunch and dinner, because no one's around. So when clients ask me, go during the meal time, and then maybe talk to the residents, see how the food looks, see how, you know, how the people look. If there's dementia and they need to be in the memory care ward, look at the eyes. And so if you've ever dealt with people that have dementia, like at Atria, my dad was there with the memory care for about a year, but I started to look at the people, and their eyes were just, there was no one there. And I made decisions like, oh, I think I need to pull him out, because he just wasn't doing that well in that wing of Atria. So then I went to Sunrise, and when I went there, I looked at the people's eyes, and I said, one of the things I said, are these people memory care people? They're like, yeah. I'm like, they look so alive. So really, there's like subtleties that when you go to these places to look for. And so then I moved him to Sunrise, and he did much better. I mean, there was sunlight, it was just the atmosphere. So sometimes these places, the salesperson, of course, wants you to go there, but you have to go and really see for yourself. Maybe talk to the residents. How's the food? How's the housekeeping? Are there enough activities? Because you don't want your loved one plunked in front of the TV and sitting there all day or unmonitored. You want them to get out and do stuff. Because a lot of things in these facilities, the social part of this makes a big difference. Without the social, then they're very lonely, and I feel it's very isolating. So if there's a lot of social things, then it's much better. Okay. Yeah.
You said 7 out of 10. I don't know, it seems like everybody that I know that passed, or it's like the majority to me didn't need it.
Mm-hmm.
And maybe 7 didn't need it, and maybe 2 or 3.
Mm-hmm.
That's how I came into this. It's like roll the dice.
Mm-hmm.
How did they come up with it? Is it? Some needed like maybe 1 year of care, maybe the
Mm-hmm.
kids helped out, kind of thing. The last year, maybe, or cancer for a year.
Mm-hmm.
Am I wrong in this?
So these statistics have been around for years. I mean, this is something that's been around for 20 years, and historically, like I said, 10. So long-term care insurance has been around since the 80s, and so for the past 20 years, this has always been the same statistic. The other statistic is if you're married, there's a 91% chance that one of the partners will need care. So it actually goes up. So this is just for a single person. As a married couple, there's a 91% chance that that one of the partners will need care.
Is this including like kids helping?
This is just nationwide. It could be including kids. It doesn't have to be necessarily paid, but yeah, it's just that the kids are going to have to step in, or you hire someone. So yeah.
This on how many actually, without a little bit of help, actually needing more help.
Oh, so AARP actually writes a pretty long. If you Google AARP, they have a really good study on long-term care.
I do this open my eyes.
Yeah.
Like,
yeah. Yeah.
Still trying to make a decision.
Sure. Yeah. Yeah. And like I said, only one out of them only plan for it. So.
Or at least one spouse helping the other, but then when the other one goes, then it's one person.
Yeah. I mean, like spouses. So if you and your wife or partner are the same age, and you have stairs in the house, and just say wife is 5'4" and the husband's 6'2", how's she gonna help assist her husband up the stairs, right? Or if you live in a 2-level house and the bathroom's upstairs or bathroom's downstairs, no, there one on the ground floor. I mean, what do you do? Or there's a bed. So all the little things that we take for granted, going up and down stairs, doing the medicine, right? I mean, how many times it's like my, I'll just talk about my father-in-law. My father-in-law has dementia right now. And so he wasn't able to qualify for long-term care. My mother-in-law did because he had congestive heart failure. But, my wife, there's 6 kids. So they're all having to rally now to go take care of him because, he was always very sharp. And, in the past year, it just kind of came on. Now he's he can wander out of the house. He can't remember anyone's name, but the medications, they have to make sure that the pills are right and he's taking them, because, you know, he could, on his diabetes medication, he could do too much, too little, right? I mean, so simple things that we totally take for granted that we could do on our own. When people have dementia, I mean, it's like everything, you know. And you know, one other story is my cousin. His wife has Lou Gehrig's, and so I remember. So I used to practice at 450 Souther. So I remember she worked in dental practice too, and she would come up and visit me. And I remember her, like, we would have the family gathering. She would say, I would say, "Oh, how are you doing?" She goes, "Oh, my arm's a little numb. I think it's because of doing the mousing from work." But turned out she had Lou Gehrig's. So now 12 years later, she is confined in a wheelchair. She could only, she uses her eyes to, you know, do on the computer to spell out things. But my cousin, who was actually a bodybuilder, he's been taking care of her for 12 years. So he could only afford to pay for 1/3 time care. She needs 24-hour-a-day care, but he could only afford 5 days a week, 8 hours a day, because it's just so expensive. So he's had to liquidate all these assets. I mean, they saved up a lot and they bought, you know, lots of properties, but because of this unexpected expense, because everything is unexpected, right? That it's decimated him, you know, and physically, emotionally. I mean, he is burnt, and it just keeps on going on. And you know, it's a really tough story. You know, it's like, you know, I wish that he bought something back then, because she would have been taken care of, right? He just told me the other day. He's like, "Oh, I lost 30 pounds. I basically sleep like 1-2 hours a night, because she wakes up, even like a scratch, she won't be able to scratch herself. He has to do it for her." So, you know, for me, for a family, it's affected our family quite a bit.
Let's say you invested and you have financially you're okay to cover yourself.
Mm-hmm.
So is this, what do you think?
So
That's kind of an optional.
So yeah, that's a good question. So this comes up a lot, and you know, affluent people buy this, and you know why they buy long-term care insurance? Because if you have multiple kids, if you start getting close to the end, then you start thinking about the inheritance. Oh, and then there's always going to be one child that is always going to be in charge of the care. I mean, no matter how you slice it, there's always going to be one, you know, one child. Like for me, I had a sister. She was in the Midwest. It was me that did it. She was older, but I was here, so it defaulted to me. So there's always going to be one child that's going to be the general. But what can happen is, I wanted my dad to have the best care. My sister's like, "Oh, I don't care if dad goes on Medi-Cal, just put him on Medi-Cal." So you might have one kid that is going to say, "Get my parents the best care." Another kid is going to say, "Oh, mom and dad, they can get, you know, minimal care or suboptimal care." So you're, and then some kids, and we just had this happen where, you know, the mom passed away. There's 3 kids. 2 kids are thinking about the mom. The other's thinking about the inheritance, right? I mean, that's this fact, right? So you know, the one that's thinking about the inheritance, "Oh, it's too expensive. Why don't she just stay at your place?" Right? And she lives far away, so she's not doing it. "Why don't you stay at your place?" But and so it's really seriously, the mom just passed away last week, and it happens, right? Out of 3 kids, you just don't know what's going to think, right? Let's preserve it. Do we really need to spend $6,000 a month, right? So that's why I say is that it takes that equation out. It takes the pressure off, and the emotional pressure of even if you have a lot of finances, what do you liquidate? "Oh, I have this property. Ooh, now we're low in cash flow. Do we liquidate it? Which, you know, what property do we liquidate? Oh, now we got to pay the taxes." I mean, so much. And, you know, I think that, well, if you could have someone else pay for it, well, why wouldn't you? Why wouldn't you? You know, put a little bit for a lot versus having to use your own cash. And like I said, with the hybrid, you know, my wife and I, we have that one. We have traditional and we have that one as too. And with the hybrid, it's almost like, well, if you get your money back and it goes to the kids, it's like, you know, why not? And, you know, I did some quotes for someone recently. When you look at a hybrid versus a traditional, over the life, you'll pay less for a hybrid because all that money will come back to you somehow versus traditional. Once that money's gone, it's gone. So that's what I have to say.
Money that you would have invested instead of the life insurance into a.
Oh, I'm comparing like a traditional long-term care versus the hybrid long-term care. But yeah, I mean, so I get that all the time. Well, I'll just invest it, and I should, yeah, I showed you the investment that if you needed 500, so just say you needed 500,000, you know, just say tomorrow you got, you know, a couple get in a car accident, they get paralyzed, right? They need 500,000 now. It only cost them, you know, 3,900 with insurance versus 500,000 in cash. Where if you have a long-term injury, 500 in cash for two people is not a lot of money. We think 500 in cash is a lot of money, but in long-term care issue, 250,000 per person is kind of the average. So that's not a very high amount. Did I answer your question or no?
And again, this is tax deductible, right?
So the premium's tax deductible, yes. Oh, and the premiums or the, when you receive benefits through long-term care, then that's tax-free. Sorry, yeah.
The difference in premium, you invest it and you get 5% versus 3%.
Yeah. So
also work out, right?
So what do you, so, but so yeah, that's a good point. So to have 500,000 tomorrow, you're gonna have to put 500,000 right now versus having the leverage of putting 3,900 to give you 500,000 tomorrow.
Oh, I see. I thought it was
right.
What you put in that accumulates for the life insurance part.
Oh, okay. Oh, we're kind of getting, yeah. So the hybrid works a little different. Oh, the hybrid. So the
difference for the hybrid and invest it instead of getting 3%, get 5% somewhere else.
Oh, okay. So the hybrid premiums are more, right? So if you think of it, it's just like if you know traditional or term life insurance is like a little bit, and then whole life is more, right? But at the end of the day, you remember the term that you get the leverage, but if you never use it, then your money is gone. With the whole life, you know, all that money you put into it will eventually can come back to you, you know, either when you're alive or after you pass. So it does come back to you. So it's very similar. It's very similar. Yeah.